Hi all. In this class, we are going to discuss one important topic in cardiac equipment, that is the defibrillator. So this word, a defibrillator, you might have heard in many movies. That too in climax scene, either the heroes or heroines met with some accident. Immediately the ambulance will come. The ambulance people, that is physician, will bring some device. They will give shock on the patient, right? So that particular device is nothing but defibrillator. Okay, so the word defibrillator, okay, the de, it's what it's called removing, and fibrillator is nothing but fibrillation. So that is some condition in a heart function, due to some abnormal action. The heart will doesn't follow the normal contraction relaxation property. Okay, so that uncontrolled contraction and relaxation of heart muscles will end up with some condition is called fibrillation. It means that irregular quivering action of the heart. Okay, it will not follow the regular pattern. It beat too fast. That means it doesn't follow the normal pattern of contraction and relaxation. It will contract and relax. It will contract the muscles or relax the muscle at too fast rate. So this type of condition is nothing but fibrillation. So the if that type of fibrillation is caused by atrial muscle, means that type of fibrillation is called atrial fibrillation. If it is caused by ventricular means, then it is called ventricular fibrillation. So these two type of fibrillation is one type of arrhythmias. It need most immediate attention in order to recover it, because if you fail to unnotice this type of problem, that is fibrillation, then it will end up with the patient death. So we have to give so much concentration, or so much focused on this particular arrhythmias, to revert back the normal heart function. Okay, so this when people have this type of arrhythmias, usually the people will have some maybe have some symptoms, or may not be have some symptoms. All of a sudden they may they may go unconscious, or they will faint out. So we used to call this a word called cardiac arrest. Okay, so in that case, we have to go with this device. All of a sudden the heart, either it will stop to pumping, or it will pumping too fast. Okay, so that condition, that abnormal function of the heart, everything we can be recovered by means of one device, that is the defibrillator. For next, we will see what is the definition of defibrillator. So as I said, the meaning of defibrillator, DE is removing, fibrillator is the fibrillation. So here, by means of this device, we are going to remove the fibrillation of the heart. Okay, so this is again is a one medical device that going to deliver very high frequency current, that is high energy shock to the heart muscle, which is undergoing different arrhythmias. One such danger arrhythmia is ventricular fibrillation. Okay, see this diagram. So in this diagram, initially the people have fibrillation, so that it doesn't follow normal rhythm, that is EP. You can't see the PQRS complex. Okay, PQRST waveform, normal ECG waveform. So the patient ECG activity would be like this in case if the people have ventricular fibrillation. Once if you are giving what the defibrillation shock, that is high energy shock, this shock is going to restore all the normal functionality of the heart function by removing the defibrillation. So that is what here we have mentioned. Like one after administrating the shock, the heart is regaining its original state. That means it's restoring the normal functioning of the heart. So that is the reason we are giving high energy shock by means of defibrillator. Okay, so next we will see what is the need. Okay, when we have to go with a defibrillator. So a defibrillator is mainly for cardiac emergency cases. So we have to identify when we have to go with defibrillator. For normal chest pain, or normal the people who undergo some kind of faint, we should not mistakenly predict that maybe could be cardiac arrest. So first we have to check whether the people have problem with already heart problem with heart already, or they may have some other related problems which is related to the heart. Okay, so after that the people may some people may have symptoms, or some people may not have symptoms, that is called asymptomatic type. So we have to analyze actually what type of problem the people is having. So if it is related to any kind of cardiac emergency, that is mainly because of uncontrolled or irregular contraction relaxation of heart muscles, or any kind of arrhythmias the people have, then the only recommendation to correct that arrhythmia is nothing but defibrillator. Okay, so this defibrillator, again it's a device which is going to give the shock in order to correct all kind of arrhythmias, that is abnormal activity of the heart. Okay, so this is the main need we have to check whether before going for defibrillator. Okay, so then next we will see what is the power of defibrillation. Yes, we know we have designed we have one device, it's going to give the shock. Then what is about the power? Okay, so here anyway we are going to apply the high amount of high frequency current. Okay, so this current, it should not possess any other problems like burning or some other side effects or tearing or something. So whatever current we are going to apply to the patient, it should no way interfere with any other problem, so that the main outcome of defibrillation will be achieved. Okay, so then we have to be very particular of choosing or selecting the power of defibrillator when you are going to apply a defibrillator for any kind of patient. So again, these defibrillator, as I know, in medical device, if you take any device in medical field, if you take any device, you will be having two types. One is internal defibrillator, another one is external defibrillators. So external type and another one is internal type. So as like here also in defibrillator, you have two types based on mode of application. You have external fibrillation, another one is internal fibrillation. Okay, so the based on the type of fibrillation, whether it is external or internal, the power choosing or power selecting will be vary from different mode. Okay, from mode to mode. If you are choosing like external fibrillation, you have to choose little bit higher energy compared to the internal fibrillation. You know the reason already, because here the external fibrillation we are going to apply outside from our body. Internal fibrillation you are going to apply the heart directly, apply the shock directly into the heart. So in that case, the selecting are sending the current, it's the amount of sending current is very much important. We have to be very serious about choosing this current. Okay, so normal shock range of applying to the patient is 750 to 800 volts, which is normally equal to connecting nearly 500 to 533 batteries in series, a batteries in series. That much amount of current we will be passing in case of treatment by means of defibrillator. Okay, so in next class we will see what are the types of defibrillators in detail. Thank you.